Well, hello, good afternoon, I'm going to say. So my name is Allison Beas. I'm a data analyst with the National Highway Traffic Safety Administration, and I've been with the agency for about 8 years. So today thank you for being in this session. It's the older population, pedestrian safety, addressing challenges and meeting their needs. So over the past decade, there has been a shift in American population. The number of people aged 65 and over has gone up from 13 to 17% between 2012 and 2022. And by 2030, as the last of the baby boomers turn 65, there will be 73 million older Americans, making about 1/5 of the American population. And a 2018 AARP study found that 77% of Americans 50 and older would rather age in place and stay in their communities as long as possible. So with this shift in demographics, we have new needs and new challenges. And one of the major concerns is that as people age, there's the loss of mobility, especially if they can't no longer drive and don't have access to safe places to walk and bike. And especially the built environment is not designed for older pedestrians. So this panel will discuss current research about the safety and mobility needs of older population, as well as recommendations for making changes to the built environment and safety programs that protect older pedestrians. And so today we have a wonderful, illustrious panel, and first I'll start introducing them. We have Dr. Justin Owens. He's a behavioral research scientist specializing in vulnerable road user safety at the University of North Carolina Highway Safety Research Center. Justin has been studying vulnerable road user safety issues for over 20 years, including safety for pedestrians, seniors, and people with disabilities. And it was a researcher for 15 years at the Virginia Tech Transportation Institute prior to joining the Highway Safety Research Center. He earned his doctorate degree in cognitive science from Brown University and a master's in human factor psychology from Clemson University. Then we have Dr. Sirisha Kothuri, is a senior research associate in the Department of Civil and Environmental Engineering at Portland State University. Dr. Kothuri's prime research interests are in the areas of multimodal, traffic operations, bicycle and pedestrian counting, and safety. And finally, but not least, we have Kim Wiley-Schwartz, has worked to make communities stronger and safer in New York City for over 30 years. Rooted in a deep educational, direct service background, Kim began working in traffic safety when a 4-year-old boy was killed a block away from her home by an SUV driver 15 years ago. For the past 13 plus years, she has served as Assistant Commissioner for Education and Outreach at the New York City Department of Transportation, where she is considered one of the country's leading experts in Vision Zero strategy and implementation. Kim manages the Safety Education and Outreach Unit with a staff of over 35 people who work in over 600 schools, senior centers, community centers each year. She manages many outreach efforts, including the distribution of 25,000 bike helmets and hundreds of car seats annually to families who need them. She also manages the NYPD DOT street team, bringing traffic safety to neighborhoods in high crash locations. She has been a member for Vision Zero Task Force since 2014, and she's thrilled to be the lead of the citywide culture change initiative for the New York City Vision Zero. Kim lives in Brooklyn with her husband, public realm expert Andy, and is a proud graduate of Hampshire College. So please join me in welcoming this esteemed panel, and we'll start with Justin. Thank you.
So thank you all very much for showing up here today. Thank you to Allison and Sirisha and Kim for joining me up here. I'm going to be sort of starting off with a kind of mile-high overview from a behavioral research perspective. I'm sorry? Thank you very much. I appreciate that. Man, I'm going to be trying to I'm a dad. I got to drop them in a little bit here now and then. Just talking at sort of a very high level, again, about the issues that are faced by our aging population with regards to pedestrian mobility. My talk is sort of going to be divided into roughly 3 sections. First of all, I'm going to talk a little bit about the statistics of senior mobility and crash rates. And actually, Allison, or you sort of already did that part for me, so I might skim over that. That's cool. Then I'll go into talking a little bit about the specific perceptual and motor and cognitive challenges that become more prevalent as we age. And especially with the aging baby boomer population, this is going to be sort of a bigger shift and push through the pedestrian population. And then finally talk some about some of the solutions, the potential, the existing solutions, and a lot of the challenges, frankly. There are a lot more challenges than solutions at this point. And I hope that's going to tee us up for some really great conversation, and these guys are going to have a lot more of the solutions than I am. So to start off with, as Allison said, our population is aging. We all know this. The first baby boomers hit 65 in 2011, I believe. And so you can see that up through, ooh, I have a laser pointer. Yeah. All right. So there was sort of a linear increase, a little bit nonlinear increase right here till that's about 2010. That's a little hard to see back there in the back. Sorry about that. But up to about 2010, you're seeing this roughly linear increase. And then beyond that, this is 2020, you see this giant jump in, this is the overall population of the US that's over 65, and then this is the percentage of overall population. So both in sheer numbers and in proportion of overall population, the senior population is rising dramatically and is becoming a bigger and bigger portion of the overall United States population. Now that is likely due to a couple of reasons. First of all, because our healthcare medication is getting better and better, so lifespans are expanding. But also, as Allison just said, we're getting this big influx of baby boomers who are entering the senior years. So what this chart on the right shows is in the light blue lines, we have the population in 2010 of 65-year-olds of 65 to 74, 75 to 84, so on and so forth. So these are increasing age groups across the bottom. And then the light bars is 2010 and the dark blue bars are 2020. And basically what this is showing is that the youngest seniors are experiencing the biggest increase in population growth. Okay, I'm not going to try to get too much more into stats, but think about that because we're going to come back to that in a couple of minutes. I think that's really important as we're thinking through a lot of the issues that pedestrians are facing. So, as I'm sure all of you are aware after being here at Lifesavers and seeing this over and over again, pedestrian fatalities have been rising over the past 20 years or so. And unfortunately, we've seen this big jump lately. I believe the latest data are around 7,500 overall pedestrian fatalities every year. And we're seeing a very similar trend in seniors here. So they're certainly not exempt from that trend. And depending on exactly how you parse the data, they are certainly at higher risk, especially the older seniors who have more frailty and more physical disabilities, more physical frailty, are at higher risk of injury and fatality than a younger pedestrian who's hit. So this is really important to keep in mind. One thing that I was thinking about as I was putting this talk together that I find really interesting is thinking about the distinction between daytime and nighttime fatalities. So overall, it's generally accepted that about 3/4 of pedestrian fatalities happen at night. And this was some of the earliest research I did 20 years ago in grad school, was looking at why that is, and I won't spend a big sidetrack on that. But that's sort of really, this graph is for everybody under the age of 65, the whole population under 65. You see that the number of daytime fatalities has gone up slightly, but over the past 20 years, it's been more or less the same. It's a slight increase. But we see this big increase in nighttime fatalities, okay? But it's always higher, right? So nighttime fatalities are always 2 to 3 times higher than daytime fatalities. Now, one thing that really jumped out at me when I was putting this together is that trend is not the same exactly for seniors. So looking at people over the age of 65, this is pedestrian fatalities, people over 65. Back in 2011, there were actually more fatalities in the daytime than there were at night. Now that sort of makes sense if you think, I'm sort of making this up, kind of pulling it out of the air, kind of pulling it out of the wind yesterday. That's the last one, I promise. But that if you have a really older population, they may be more likely to want to go outside and do things during the daylight hours. So this sort of makes sense. But what's really interesting is if you transpose this blue line, this is the nighttime fatalities, not only do they cross over here right around the time the baby boomers are turning 65, we're seeing a very similar trend here to what we see in the overall pedestrian fatalities. And why might that be? Again, I'm making this up. I would love to talk with anybody that knows the answer or wants to do research on this, because I think this is really interesting and important. The best guess that I can make right now, and I'm just pulling it out of the air, is that we're having this shifting demographics of the senior population, where all of a sudden there's a lot more people in that 65 to 70 age range, and as younger seniors, they may be more likely to be out at night than older seniors. And so as this group transitions through the next 20, 30 years of their lives, we want to think about how their transportation patterns may differ from previous generations of seniors, and how that interplays with the kind of mobility limitations that I'll be talking through the rest of this. So with that said, any questions before I move on? I really hate talking 20 minutes straight. All right, so let's shift over to thinking about the different types of mobility-related differences or disabilities that can come with aging. And these we can sort of broadly lump into three categories, which of course are not mutually exclusive. We have perceptual difficulties, physical difficulties, and cognitive difficulties that obviously don't affect everybody in the same way. There's a lot of heterogeneity, but in general, people over 65, over 70, over 80, the likelihood of having one or more of these disability or disabling conditions becomes stronger and stronger. So for example, let's look at, these data are from CDC. This is the sort of composite prevalence of all disabilities together with ages. And so I'm really sorry that this text is so small. I think we needed a much smaller room or a bigger screen. But basically over here we have 18 to 44. This is everybody who's young to middle age. Really pretty low, less than 5% have some type of disability. But again, you see this sort of linear increase and then this big jump over the age of 75 up to about 27, 30% have some type of disability. And we could go into this, it depends on how exactly they define disability. But let's break this apart a little bit, okay? If we look at difficulty hearing, again, we see this big increase that obviously as you get older, it gets harder and harder to hear things. And as we'll see in a couple of slides, in some cases that can be, that can be treated to a certain extent with hearing aids, but really only a relatively small proportion of people who could use hearing aids actually have them. Difficulty seeing was a little bit interesting because there's not quite this big jump that we see in the others. And I think this could be really interesting to parse apart a little bit because I have contacts. Technically, I have difficulty seeing, right? But the types of, the types of serious visual impairments that become more prevalent as you age, like cataracts and glaucoma and things like that, really affect people in the upper age groups, and they're much harder to treat with just a pair of contacts or glasses. And finally, this is really one that we think a lot about when we're thinking about mobility, is physical mobility. And so they asked how hard it is if people have difficulty walking or climbing stairs, and we see this huge increase. So this second to right bar is 65, so that's normally what we think of as the cutoff for seniors. So again, people over 65 have almost twice the rate of people in their sort of upper middle age, and then it gets almost double again, up to 50% of the senior 50% of the senior population over 75 report having difficulty walking. And this brings us back around to what we're talking about here today as pedestrians. So for the next couple of slides, I'm going to go a little bit more in depth on what we mean by each one of these things and what specific types of challenges and disabilities may be faced as people move through their senior years. And then we'll shift to thinking more of an aggregate, like how does this affect the different aspects of mobility? I'm just going to pause for just a moment here. I'll blame the cheesecake again. So good. All right, so as I mentioned earlier, a lot of folks have visual impairments, but the types of visual impairments that are really hard to correct, things like macular degeneration and cataracts and glaucoma and retinopathy, these kind of things are most prevalent in people over the age of 65. So these graphs are, there's neat little infographics, let's not say graphs, are from the NIH, and they represent the sort of weird slice of the eye here represents the proportion of the senior population that's predicted by 2050 to have each one of these different types of visual impairment. So at a high level, we can say that they're roughly going to double or triple all of these things from macular degeneration, cataracts, glaucoma, so on and so forth. So the takeaway from that is that not only is this something that really affects the senior population now, but it's going to affect more and more and more people over the coming decades as well. Similar things with hearing loss. As I mentioned earlier, really only about a third of the people over the age of 70 who have hearing loss that could benefit from hearing aids are using them. So obviously that affects mobility. So our ability to see the world, our ability to hear the world plays a huge role, obviously, in how we're able to move through the world. What we think a lot about when talking about senior mobility issues is actually physical changes in mobility. So this is things like general mobility, your ability to walk, your ability to walk upstairs, down slopes, long distances, without taking a rest, things like that. Interplaying with that, of course, is the usage of mobility aids. Okay, and this is start to where we get into thinking about things from a disability mindset, because although the ADA specifies some things like curb cuts, very often it's really hard for people who are in wheelchairs or walkers or use canes or other types of mobility devices to make their way through the built environment. Specifically, perception-related mobility can play a big role, like your ability to turn your head. So this is obviously a big deal when you're driving, and this is why blind spot indicators are really important, particularly for seniors. But when you think about being in an intersection, especially if it's not a signalized or crosswalk intersection, you have to be able to move your head back and forth pretty quickly and be able to perceive what's coming from each direction. And of course, this plays into your visual abilities too. If you have cataracts, that's going to make it much harder yet, to be able to quickly look and see what's coming and where it's coming from. Okay? Things like balance and strength and coordination obviously play a role in your ability to actually move through, and your reflexes. If something comes surprisingly, your ability to step back, right, onto the sidewalk. So we'll come back to that in a minute as well. And then sort of the third piece of this puzzle is thinking about the cognitive changes that can happen that become more prevalent with age. These are things like mild cognitive impairment and dementia, which could lead to Alzheimer's. Depression can be at a higher rate among some senior populations. And often there can be medication-related cognitive issues. So obviously as we age, we're taking more and more medication as we have more medical concerns and considerations. And so there's a lot of polydrug stuff that really hasn't been done that should be done more, that can cause all sorts of transportation-related difficulties, whether pedestrian or driving and so forth. So now that we sort of have kind of this overall thinking about the types of impairments that can affect people as they age, let's think about specifically how those individually and the interplay among those can affect pedestrian mobility through the world. So I'm talking about this in sort of the disability framing, and it's not exactly a one-to-one relationship between the issues that seniors can face and disability, but I think it can be a useful mindset, and in many cases it does manifest as disability. So as I said, these sort of, we can sort of think of these as physical mobility-related disabilities, perceptual communicative, and cognitive developmental, and of course those aren't in isolation. All of those can interact with each other. There's a lot of comorbidity. It's unusual that anybody really would have one and not one of the other of these things, especially as we age. So people with physical and mobility limitations can have things like requirements for device use, so a wheelchair or a walker or a cane, and can face issues in the environment like missing curb cuts or sidewalks that are buckled or simply non-existent or under construction, may require increased crossing time at intersections if they're moving more slowly, may have more likely to be fatigued, so if there are not places to rest more regularly, this can be a challenge. And as I said, obstructions. So if the sidewalk's out, if there's just a buckling that can be really hard to get over, if there are grates in the sidewalk that could catch a cane or a walker, if there's stairs, I had a picture, I didn't use it in this one, but I was in San Francisco a couple of years ago for ABS, and I couldn't believe how many sidewalks were just stairs in that city. It's wild. So just to think about the ability of people with limited physical mobility to move through those types of situations. And then we think about more specific motor control challenges, things like actual ability to move your fingers and limbs in a very precise manner. So things like difficulty executing controlled movements that are required for not only things like crosswalk buttons, but even things like working with smartphone apps to hail an Uber or a Lyft that many of us take for granted, that if we get in a situation that we can't get home, whatever, no big deal, I'm just going to bring up a Lyft on my phone. And that could be really hard. And again, that's not specifically only from a motor control challenge. That could be visual limitations, cognitive limitations. So anyway, we'll come back to that. From perceptual communicative perspective, things like maintaining situational awareness. So if you have a hard time seeing and hearing what's going on in the world around you, you have a harder time predicting where other vehicles and other road users are and when it may be safe for you to cross the street. Localizing those things, identifying where a safe location to cross could be, especially in areas that don't have crosswalks. There are a lot of areas, as we know, 3/4 of pedestrian fatalities happen away from intersections, because intersections, especially in non-urban areas, they might be 3/4 mile down the road to get to a crosswalk. So trying to identify where it's safe to cross can be a real challenge. Again, talked a little bit about curb cuts and things like that, actually finding these things. And there's interactions among these two, by the way. There's some neat interesting, maybe not neat, examples of when the tactile walking surface indicators came out and were specified by ADA so that people with visual limitations could tell when they were transitioning from a sidewalk to a street. That then began to pose a challenge for people who use mobility devices because things like walkers or canes or wheelchairs could get trapped up in those. So there's these really challenging ongoing conversations among all of these, which is why I keep coming back to thinking of this as a system and not individual isolated problems. I'm going to sort of skip through some of this because I realize my time is starting to get tricky and I have a few more slides yet. From an auditory perspective, again, maintaining that situational awareness, particularly with electric vehicles, I think they're all required now to make that sort of sound that's really kind of annoying, but is really important for localization, but may or may not be as good as the sound of an engine coming. Finally, again, there's an increase in prevalence of things like dementia and cognitive impairment, things like that, which can affect people's ability to actually decide where and how they're going to travel. So how they're planning their route, how they're doing multimodal traveling, if they can remember where they're getting from point A to point B, especially if they're not proficient at using smartphone navigation devices, so on and so forth. So we can talk more about that in discussions if anybody wants to. But finally, I just want to bring it back to that these are not all in isolation. There's interplay among all of these, both on an individual level and a societal level that we have to keep in mind. So I want to shift now to thinking about how the external environment interacts with disability or with aging. What sorts of external environmental factors mediate or influence or interact with disability? And that can be things like, as we talked about, the infrastructure, signage, the type of technology that's both available and usable, which is near and dear to my heart as a human factors researcher. Transit availability, vehicle automation. I could spend another 20 minutes at least talking about automation, but I won't, I promise. Surface conditioned weather, so sidewalks that may be traversable in dry weather may not be when they're covered in water, or when we had the 347 mile an hour winds yesterday, it was blowing me over, like trying to think of somebody who is relying on a mobility device to be able to walk through situations like that. It can be a lot more of a challenge in the built environment, even the non-built environment. And again, I keep coming back to this. It's getting boring by now, but there's interplay among all these things, and that's so important to keep in mind. So I'm really quickly just going to go through a couple of really these are mostly nascent solutions, okay? So the ADA has been wonderful. It's really standardized a lot of really important things, but it's not really retroactive, so there are a lot of areas and a lot of places that still don't benefit from or have the ADA implemented guidelines. So more is needed beyond the sort of minimum that's being used there. There's a lot of technology and community solutions that are just starting to come out, and I'm hoping my lovely colleagues will talk a little bit more about this so I don't have to. But things like paratransit, which is really important but has a lot of logistic limitations. Automation is always 10 years off. Automation, letting everybody have individual mobility, just 10 more years. I've been hearing that for 20 years. Things like individualized routing is really cool. There's a lot of really neat technology implementation things out there, but they're really expensive. They're really disaggregated, if that's the right word. They're different among platforms. They're different among locations. It's really confusing and convoluted. So really what I want to wrap this up by saying is that in order to solve any of this stuff, there has to be communication among all the stakeholders involved. And that means, most importantly, talking with the communities that represent the aging and disability communities and the broad range of people within those communities. Bringing them into conversation with policymakers and planners, with technology creators. It's so wonderful to see all these different apps and Bluetooth beacon-based solutions. And I had a video that I didn't have time for here. If anybody has one of the newer iPhones with LiDAR, go look up the door detection. It's a neat idea that is so poorly implemented, and I'm so sorry if there's any Apple engineers here. But it's a really cool idea that you walk around with your phone up like this and it says door ahead 5 feet or whatever, but it really doesn't work very well and it's hard to use. And again, I'm putting in a plug for human factors guys like me, that there's all this great technology out there, but if it's not usable by your target audience, then what's really the point in doing it? Consider principles of universal design, that we can design things that are usable by everyone. I'm just going to skim over this on the next slide, but this is worth looking into, that there are multiple models or ways to look at the concept of disability, right? And it's easy to get locked into one perspective, like thinking about disability from only a medical perspective, like disability is a medical problem to be solved, or disability is a social problem or a charity problem that if we just throw money at it, we can fix it. And not one of these is a good individual way of looking at what disability is, because they all capture different aspects. And again, it's thinking about systems as a whole and thinking about ways to incorporate all perspectives. And this is my last slide, Allison, I promise. To conclude, the population is aging rapidly, thanks both to advances in healthcare and to the baby boomers turning 65, 70, 75 now. We're seeing this really terrible but scientifically interesting rise in nighttime fatalities among older pedestrians. I would love to do more research on that if anybody wants to talk after. Seniors face a range of potential impairments as they age, from physical, perceptual, and cognitive perspectives. And we have to think about ways in which all the varying differences among folks and disabilities affect mobility, and know that it doesn't affect anybody in the same way as anybody else. Okay? Solutions aren't easy. That's why I'm tossing it to these smart people, because I don't know what the answers are. But they all have to be considered multidisciplinary, which is why I love Lifesavers so much. This is my favorite conference because we get to talk to people from all different disciplines. So with that, I will say thank you. Thank you, guys. I guess we'll save questions at the end. I can talk another 40 minutes. Thank you.
All right. Good afternoon, everyone. My name is Sirisha Kothuri. So today I'm going to be talking about this project that we did for the Oregon Department of Transportation on addressing Oregon's rise in deaths and serious injuries for older drivers and pedestrians. Since this session is particularly focused on older pedestrians, I'm going to talk about that specific part, but if anyone's interested in what we did on older drivers, that's available in our report. So before I move forward, just wanted to acknowledge the efforts of our other team members who played a very important role in the project. Chris Monsier and Jason Anderson from Portland State University, and David Hurwitz and Cadell Chand from OSU, Oregon State University. So the main motivation for this project came about because between 2013 and 2016, there were 884 older driver serious and fatal crashes and 112 older pedestrian serious injury crashes. And this triggered the special rule for older drivers and pedestrians, which basically states that if there is an increase in the preceding 2 years for injuries, serious injuries and fatalities related to older drivers and pedestrians, then states have to take action and implement strategies that would improve their safety. So Oregon DOT came to us and wanted us to conduct the study and basically do a data-driven approach to come up with some solutions. So the objectives of this study were, we wanted to identify locations where there's an overrepresentation of these serious injury crashes. We also wanted to conduct a review of best practices locally and nationally. So this included looking at countermeasures that were used by other agencies and states, and so that we could bring that knowledge back. And then finally, to map the best practices and countermeasures to Oregon so that we can make significant improvements to older pedestrian safety. So pedestrians, when we looked at the literature, and Justin, you did a great job in setting up the context for this, older pedestrian collisions with vehicles are more likely to result in a fatality. And this is because of the physical frailty that Justin referred to. Older pedestrians are also more likely to have visual and auditory impairments, as well as cognitive declines. We also saw research that showed that when older pedestrians will accept shorter gaps in traffic as vehicle speeds increase, and that is really an adverse situation for them. Some of the safety strategies that we saw in the literature were these protected or leading pedestrian intervals. So this is where the pedestrian is given a head start at the intersection before the parallel vehicle movement commences. That allows the pedestrian to increase their visibility in the crosswalk, and then also improving visibility in other means like lighting and other conditions, and as well as installing pedestrian countdown signals, which basically provides information to the pedestrian about the amount of time that is left in the phase for them to complete their crossing safely. So as I mentioned previously, we undertook a data-driven approach to this. So we got the Oregon crash data from 2013 to 2016, and we looked at 4 years of crash data because we wanted an adequate sample size and also wanted to have some sort of temporal stability. So we did 4 types of analysis on this crash data. We looked at some just descriptive analysis based on the frequencies, and so, and I will show that to you in just a second. So we're looking at the different characteristics and how crashes vary across these characteristics. For example, time of day, day of week, etc. We also looked at the comparison of older pedestrian crash proportions to the other age groups, like Justin was referring to see how these raw frequencies compare, and also looking at some statistical tests to see where these differences are and where these older pedestrian crashes are overrepresented. Then we looked at determining the important predictors of older pedestrian crashes, because these are then variables that we need to take into account and can develop countermeasures for. And then we also looked at spatial trends based on population. So where are crash rates the highest when we account for population? And so we can sort of target our efforts in those places. So this slide here is just showing the different characteristics that we looked at for the different crash attributes. And as I said, we looked at time of day, day of week, weather, surface condition, what the vehicle was doing, driver, gender, pedestrian gender, etc. So what we basically found was that most of the older driver crashes, or the highest proportion in our sample, were between 3 and 6 p.m. and 27%, and then 21% was between 6 and 9 p.m. In Oregon, especially in the winter months, it does get dark by 4 p.m., so that could be a factor. In terms of day of week, we saw that most crashes occurred on Friday, 24%. Road classification is really important. We have seen studies over and over again showing that these urban principal arterials, urban minor arterials are really problematic for safety, because these are locations which are high speed, number of lanes to cross, and lot of traffic volume, and so these are particularly dangerous, and we are seeing that in the data. In our particular sample, we're seeing more intersection crashes at 55%. And then the lighting condition, we did see about 47% of crashes in daylight. But when you look at these other categories, the dark with streetlights, dark without streetlights, dawn and dusk, when the ambient light is low, that is 53%. So that is again showing that nighttime or darkness is a big factor for pedestrian crashes. We're seeing males being overrepresented in these crashes, 62%. And then in terms of pedestrian action, crossing between intersections or away from the intersections was our biggest predictor, 24%. And then the drivers, again, males being overrepresented at 56%. So next we looked at these proportions, trying to compare the older pedestrian crashes to these different age groups. And so the table there shows the number of crashes that we're seeing in the different age groups. So this is just a graph that's showing the raw frequencies. The dashed black line there is the one that corresponds to the older pedestrian crashes. And so once we had this, we were able to look at, statistical differences. So where on these crash attributes are we seeing the greatest difference between the other age groups? And so these results, sometimes we were seeing these differences with a particular age group, but sometimes it was with all age groups. So this is also, again, providing us important information about where we should be sort of focusing. So the next step here in the analysis was to look at this variable importance and then For this, we use the random forest analysis. I won't go into any details regarding that, but this is a sort of analysis that can show you what are your most important predictors for these types of crashes, so then we could map countermeasures to those. So this graph here is one of the methods that we used. So the way to interpret this graph is that the crash attributes that are the highest have the most impact on accuracy. And so the number one factor here we see is darkness, as Justin was referring to. In our data specifically, we're seeing intersection crashes are a big problem. And so this is one method that we looked at. The other method that we used, the other metric to evaluate crashes, showed us that urban principal arterials, urban minor arterials, darkness, again, are all significant factors. So our next step was then to look at the spatial distribution of these crashes. So where are these crashes distributed? So just for context, that's Portland, Oregon. This is the I-5 corridor. So this is where most of the population lives, and so you'd expect, most of these crashes here. But then these are also areas which have higher population. The eastern part of the state is more rural and fewer population. So then we looked at, again, normalizing this by population, and our analysis revealed that there were 6 counties that were overrepresented for these older pedestrian crashes, and they're all listed here. Most of these are pretty rural counties, except Washington, which is, it's a suburb of Portland, so it has suburban context as well as rural context as well. So once we understood the crash data, our next step was to find countermeasures to see what could help mediate some of these crashes. And we have a whole list of countermeasures that we pulled from existing literature and other documents, and they're all listed in our report, and they're also categorized by low cost, medium cost, or high cost, and the time that it would take to implement, so that agencies can easily see what the effort is. So once we had these countermeasures, then we convened a workshop, and as Jason said, we needed to bring all the stakeholders together. And the idea behind this was specifically bringing these stakeholders who are responsible for policy and design guidance as it related to older driver and pedestrian safety. The objective there was we were going to present the results of our crash data analysis, present the best practices that we obtained from the literature and the map countermeasures, and then collectively as a group, we identify potential opportunities for improving policies and procedures at ODOT. And then as the research team, we would then take that input from the workshop participants to help guide the project recommendations. So we were looking for that buy-in from the different stakeholders. So we developed a list of these workshop participants in consultation with the project coordinator. So we had ODOT personnel that were responsible for policy and design. We had representatives from counties that were overrepresented in the crash data analysis so that they could tell us about, local context and what was happening there. We also had agencies engaged in older driver safety, since this project involved both, so AAA, AARP, and we had the representation from the League of Oregon Counties as well. So we held this workshop at the ODOT facilities in 2019. We divided the participants into 4 groups. Each group had a mix of stakeholders, so we could, each of them could learn from each other and also hear others' thoughts and opinions. So we divided the activities into 3 types. The first activity was we gave them, all the patterns that we saw, the graphs and plots that we produced, and asked them to document what they are seeing in the crash data and to discuss the trends and any overrepresentation that they identified as expected or unexpected, because these were all, either transportation professionals or out in the field. They had an idea of what was going on. The second activity was for them to brainstorm solutions. That is, if they had no dearth of resources. So if they had everything at their disposal, what would they do? And we gave them a few categories to sort of come up with solutions. And the third was then we gave them our list of countermeasures and then asked them to identify any potential systemic policy or high-value solutions. So the idea here is we want to implement policy changes. We want to implement it on a network basis. We don't want to do, hotspot improvements. And so what can we do to find these systemic solutions? Oops. Okay. Oh, no. Okay. So this is basically the summary of the activity one, where we ask people to, document the crash data patterns that they saw. So we have the results from each table. So what, basically the crash trends that they were seeing. Like table 3, for example, thought that urban classifications was really important. We've seen more crashes in the urban context. Then crossing at intersections without signals, daylight, not at intersection. Okay, so the second activity was to brainstorm solutions. And here, these are the 5 categories that we asked them to select solutions. So, they looked at access management, driveway spacing, crosswalk spacing, lighting visibility at intersections, crossing visibility, and turn restrictions. And then finally, we went through the exercise of identifying really definitive particular countermeasures. So these are the systemic solutions that ODOT could then implement on a wide-ranging basis to improve older pedestrian safety. And some of these solutions are just not specific to older pedestrians alone. They can improve pedestrian safety on a wider basis too. So the values in green here are the ones that indicate the most, the top priority votes. The values in yellow are the second priority, and then the values in orange were our third priority. So in terms of the top priority solutions, what we came up with was these increased use of protected left turns. So left turns are particularly problematic for older pedestrians because the vehicles are traveling at a higher speeds. And so that can result in a serious injury or crash. Shortening crossing distances either through the use of curb extensions or medians, and then improving pedestrian visibility through illumination and other means. We, as a part of the third activity, we also asked the attendees to tell us about the documents that they generally use for design standards or policies, so that we could, recommend changes to these design standards or policies, so that these solutions that we come up with are more widely used. And so these are a list of the documents that they use at ODOT. So then in conclusion, the objective here was to identify a data-driven approach and strategies for addressing older driver and pedestrian safety. Research methodology, we included the literature review, state of practice review, holistic crash data analysis, a compilation of countermeasures which were then matched to crashes, and then doing this community engagement in terms of workshop to identify opportunities for improving policies and procedures. So some of the risk factors for older pedestrians from a review of the literature are this increased risk of falling while walking, slower walking speeds, and accepting shorter time gaps when crossing. I think I'm going to skip through these, and get to the recommendations. So The first recommendation we had was a lot of these crashes were occurring in darkness. And so to really look at illumination at intersections or at crossing locations and to improve that. The other recommendation provided was to implement RRFBs or other active warning devices, because these can also increase the visibility of the crossing pedestrian, especially at locations that are away from the intersection or mid-block. The second recommendation that we made were related to left-turning vehicles, which accounted for 19% of the older pedestrian fatal and serious injury crashes in our sample. So one of the countermeasures was to slow down left-turning vehicles. I know that New York City DOT has used these hardened center lines and the left-turn wedges to slow down traffic. So that was one of the recommendations. Eliminating permissive left turns where possible and increasing the use of protected left turns. And then also implementing these protected pedestrian faces or leading pedestrian intervals, especially near older communities, could also help. And then the third recommendation was the proportion of older pedestrian crashes in the roadway was significantly different when compared to other age groups. So this is again relating to the crossing distance. So anything that we can do to shorten that crossing distance in terms of providing median islands or median refuges, curb extensions, which can also shorten the crossing distance, as well as raised crosswalks and road diets near older communities. I think that's all I have. Thank you.
All right, everybody. Now we're going to do this New York City style because I got a lot to say, and I'm going to try to do it really quickly. You ready? So in New York, we actually have a study. We've now implemented a lot of these ideas and also considered a lot of the things that Justin was talking about. So as professionals, what can we do when we know these things are happening? So let's go through this. And in this presentation, first I'll talk about Vision Zero because I can't help myself. Then we'll talk about the statistics and how they kind of countered our assumptions. We'll look at the older pedestrian study. I'm just going to give you a little taste of it, but I'm going to want everybody to download that. And then we'll talk about how we form education, outreach, and enforcement around the information. Everybody ready to go? All right, let's do this. So first of all, before Vision Zero, for those of you who may not know, we had started really implementing things in New York City quick. We use Quick Build, and we're just trying to solve this problem, right? This is happening all over. You see that woman, she has no idea where to go. This guy has like 1,000,000 miles to cross the street. So we learned to fix it with our sidewalk crew and get, just make some reasonable decisions about where people should go. So we've been doing this for a long time, since the Bloomberg administration. But what we really weren't doing was working together. And so 10 years ago, we started putting everything together, looking at, of course, the 3's we're so familiar with, and doubling down on legislation, but more importantly, taking public policy and making culture change as a multi-agency effort. Sort of like what you're talking about, Sirisha, with trying to get everybody together. And also bringing in our advocates, and you may meet some people from Families for Safe Streets who said, this is no longer acceptable. Well, if it's not acceptable, we're gonna have to all work together. So the Vision Zero task force gets together every 2 weeks, and we think about this as a group all put together. What solutions do each of us have? And you may have seen my DCAS colleague who's here. They want something about putting intelligent speed assist into fleet vehicles, right? We're thinking all the time about how to deal with this. But what else does it mean? It means, we gotta have data-driven, evidence-based solutions, right? We can't just say, oh, we think that this is why people are getting hurt. We have to understand, to put in our designs, our enforcement strategies, our communication, and we have to have multi-level approaches to drive this down, and a comprehensive speed management program that includes automated enforcement. And unlike the rest of the country, last year we had our lowest pedestrian fatalities in the history of taking in data 100 years ago, right? So there's something going on, but don't clap too much because then I just jinxed it. Erica jinxed it. I shouldn't have said that out loud. Happens every time. But so there's something going right. But part of it is because of our keen focus on, vulnerable road users, right? It's still a leading cause of child fatality in New York City to be struck by a vehicle. But if you look at this, 15% of our population in New York is 65 and older, and they make up 45% of our fatalities as pedestrians. So we got to work on this, all right? So first, when we think about statistics and assumptions, I want to say one thing. When we talk about older New Yorkers or older Americans, we're just talking about us. Us. We're all hopefully going to be older, right? So we have to start thinking that way. I'm going to be 58 this year. So, I've been working on this for 15 years, and I started thinking that way 15 years ago. I thank myself. My future self thanks my present self thanks my old self, right? So we have to really think about this, and I'm sorry this is a little hard to see, but this is our main statistics, right? These are all the age groups across the top and the leading reasons why people die. And that red circle there is traffic crashes. It's the third leading cause for anyone who is 65 or older. So this is a big problem. And we really need to deal with this, and my colleagues really discuss this. We know this, frailty, we know perceptive deficits, people on medication. All of this is definitely happening to me already. So why these disproportional numbers, right? Let's make some assumptions, right? So older people walk more slowly, right? They act different. Maybe they cross in the middle of the block, or they see the flashing hand and they go anyway. They remain inattentive. We have a lot of, driveways in New York City. Maybe they're not paying attention to that. And it's obvious that they must be being struck more often than younger pedestrians. Like, they are dying so much more, right? These are our assumptions, okay? So how about if all my friends, the most amazing research team in the country, Rob Viola, Emery Doherty in New York City, and this is the study, you can grab it if you want to. They said, let's take everything and let's really think this through. Like, let's drill down, let's see what we're putting on the street, let's see what's really causing these fatalities, let's do the work, let's get curious, and then let's ask him to make a campaign about it. So for us, we released this in 2022, and it analyzes the key factors for this are killed and seriously injured, are KSI. You guys are going to have to know that for the rest of this. And it identifies specific engineering and enforcement strategies. So I'll kind of try to bring it home here, guys. So one of our key findings was older pedestrians are very similar to younger pedestrians. There is nothing they're doing differently than younger pedestrians. Also, they're struck no more often than younger pedestrians. They're just more likely to suffer worse outcomes. Also, older pedestrian fatalities are more likely to occur close to home, this makes sense, and in the middle of the day. In New York, almost always. And our left turn fatalities are far more injurious than our right turn fatalities, okay? So this is, you don't really need to be able to see exactly what this is. You can see it in the report. But first we have to ask ourselves, where are the injuries happening? So that hot pink there, that's where the injuries are most likely to happen. These are the 5 boroughs, okay? We take that and we also look at the population density. Where are more older adults living? And when we put that together, my research team lets me know where I need to go on the street to talk to people, and those blue areas would be our senior pedestrian zone. So if you work in a city or anywhere, ask your research team to do that work, put it together, and you'll know where your efforts will be most likely to help the situation, right? Because we can't go to all 400 senior centers a year in New York City. Also, here we want to go to where many of our KSI happen and where our most densely populated senior populations are. So it's really important to think this through. You got to slow vehicles down. You got to reduce pedestrian exposure at crosswalks, which means you got to slow everybody's turns, and you got to provide people a place to stand, okay? That's it. So slowing speeds and turn with design, that's going to really help you out. Reducing turn conflicts and long crossings, that's really going to help you out. And creating pedestrian spaces on the roadway with curb extensions and medians. Everybody still with me? Great. So this is the term calming treatment you talked about. So this is something that my colleagues have been doing. You can see there's places where down where the cab is, where we just put a row of hardened bollards so you can't turn anything but in a 90-degree angle going left. That way you never lose the pedestrian in your A pillar when you're making the turn, right? Because again, the senior isn't doing anything different, just if they get struck, they're more likely to die. They are not being more risky. If you lose them in your sight and you hit them, they're gonna have a worse outcome. Or as you can see here, this kind of treatment where we make sure that you, as you make that right-hand turn, you can't cut the turn, or this left-hand turn on the other side. And these treatments have huge safety benefits. This is what it says in the report. When we do turn calming for senior KSI, we have a 60% reduction in the outcomes, right? 60%. That's intense. So we're going to want to put that as many places as we possibly can. And you can see our non-senior adults, the truth is it doesn't really help them that much, but it really helps our older adults, which is just us. We're going to want that in the street when we're that age, right? Also, our leading pedestrian intervals, which you spoke of as well, right? And as you said, I get the walk signal before the cars get the signal. That means I'm less exposed. I walk, and then the car goes. And by the way, that is our leading cause of child injury. Child is walking with the signal in the crosswalk, doing everything right, and an adult tries to take the turn. So this is helpful for our 8 to 80 group here, and it really helps. Here is the thing that blew all of our minds. When you put a bike lane in, a protected bike lane, the people that have the most safety benefits are not cyclists. They are older pedestrians. And we have a 39% reduction in KSI when we put in a protected bike lane. Like that one you see outside of, on California, when you're walking there, that little green bike lane. Because that senior pedestrian can look both ways, cross over the bike lane, wait in the refuge spot, and have a far less crossing distance to get across, right? And so the funny thing is, who are the people who complain to me the most about bike lanes? Older New Yorkers. It goes like this. That crazy bike lane that you put outside, I don't know, it's scary. And I'm like, it is actually scary. But if you look both ways first, and you don't even have to cross with a signal, you can cross whenever you want. And so we literally go from place to place, training older New Yorkers how to deal with these things. They're their best friends. So now what? So now I have all this information. Now I got to do something with it, right? So the first thing is, let's talk about enforcement. We have some really interesting findings here. Let's think about how it's going to affect our plan. So our police department tends to do a lot of their enforcement on the last tour, on the third tour, overnight on the highways, okay? Or they sort of do it in the afternoon, evening, because of our dusk and darkness problem. But what does the data show? The majority of crashes are between noon and 3. So we're going to start changing the enforcement to our first tour, to the first shift, not just evenings. We're going to ask, especially where? In those 10 pedestrian senior zones. That's where we're going to get the best bang for our overtime buck or our change in shift. Left-hand turn crashes are more deadly. We need failure to yield enforcement. That's when an officer actually is in plain clothes and she walks across the street and someone tries to cut her off and there's a car right there waiting for the person in the car and they get pulled over immediately. I'm a big fan. Big fan. Fatal crashes occur closer to home. So for a long time, our police department was like, we're going to do all the enforcement near the senior centers. But that's not it. It's true for schools too. It's not that block next to the schools. It's that whole walk from home to school, the whole walk. So we got to change our focus and move out from just the adult center. And from my perspective, I better start talking to seniors about how they want their streets to be, because they know better than I do. And rather than just getting stakeholders together like the people who do the work, the real stakeholder here is the person who is walking in an older body. They're the people who need to be heard from. And they do need a little bit of help, right? But one of the things we show them is, okay, so here's some of the things we can do for you. Do you see how crazy this was? These guys are going to try to cross the street here and they can't see. That's not good. That's bad. How about if you ask for a curb extension? Then if we put a curb extension in, you'll have a place where you can come, where you can cross first. Or maybe you live in a neighborhood like this that's just like a little highway. Just medians are just such good places to wait. But they also will reorganize the traffic and make it go down. No, that's actually the same place. Everybody with me? That's the exact same block, right? This is so much more walkable. Or my favorite, outside of a school, I don't know, I mean, that guy's, he's jaywalking, but I kind of don't blame him. How does he even know where you're supposed to go? Well, he's not gonna, if he's older, that's gonna be a real problem for him. So why don't we just put that in the middle? And then you will have a place to walk with good crosswalks and a great outcome. So this is what we tell them they can ask for before we have our talk with them. And we say, hey, if you're worried about pedestrian safety, here's some of the things you can ask for. Leading pedestrian intervals, better crosswalks, medians, curb extensions, countdown signals. Or if you want to reduce, speeding, we'll calm your turn. We can use traffic signals. We can use speed bumps. We can, we can make like narrower lanes for you. Or we really think you should ask for some bike safety, even though you're scared of the bicyclists. They'll have a place to be, but also, trust us, you get really good results. So that's what we do. And then we also try to go out and talk to people about this. This is one of our educational materials. Believe it or not, this is our senior pedestrian brochure. Well, those people in the middle of the brochure don't look like seniors, do they? Well, that's because I don't want to be out in the street and be like, well, you look old. Can you take it? Excuse me. No, not for you. No, this for you. You seem old. You're more likely to get hit by a car, right? Or a driver, I should say. So we push the older adult information inside of the pedestrian brochure, so that gives us ability to really talk to people and has a lot of information in there. The other thing that we really try to do is we try to reinvent how we show our older New Yorkers. That this is a senior center that has a bike club, and those women are in their 70s for sure, right? They're just out there biking. Or these people that I got to tell their stories about all their commutes and how they walk and the things that they think about. Those are just regular New Yorkers who walk around the city who want to tell their story. So this is another way that we can connect with ourselves as older people and older people by really just talking to them about this. But if you look at these tips, again, it's not like you're old, so you're going to get hit by a vehicle. We even say, hey, do what you can to be seen, right? And I don't mean retroreflective vests, which, as Eric knows, we had a police chief who wanted everyone over 65 to literally be given a vest, which would really not match my outfit today. I'm just saying, not going to be good for me. So, this is what we need to do, really talk to our older people about this kind of stuff. And with that in mind, I guess we're going to take questions.
I just want to thank the panel. They did such an amazing job of putting everything into context and then also showing us countermeasures and then really how important community engagement is and getting those folks that are using it and then really practical solutions. I mean, like 60% reduction, like take that to the bank, people. Come on. So I'm going to take questions. So please feel free to raise your hand. Do we have any questions? Please go ahead.
How do we fund all this? Well, it's over a long, let's be honest, it's over a long period of time. So one of the things is, one of the ways you fund it, and Vision Zero is well funded, right? But again, right now, the way we're funding things is we have arguably, the most money flowing out of the US DOT that we've had in a very long time. So let's take advantage of that, right? But the way we fund it is exactly this, that I have a group of organized researchers who say, this year we're going to these 10 locations. Then the next year we get that better, then we'll go to these 10 locations, and so on and so forth. You do have to be careful, right? Because you don't want to only go where, like, what people will say is, we waited for someone to die before you came here. But so you're looking for patterns, but that's really the way you do. You got to keep moving and keep building a group of improvements. And in the meantime, you send me there with my team. We're not that expensive to run my team, to go out and talk to people, so, really help them beforehand.
Maybe you can cross the river to New Jersey.
Yeah.
Are you in Hoboken? Are you in Jersey City? I'll come to any place. But I ran an after-school program in Hoboken for many years, so I always like to go home.
But I do want to plug the Safe Streets for All grant, the reconnecting communities. There's a lot of funding coming out of US DOT. Really connect with other, within DOT, see what other sources there are.
Yeah.
It's all about connecting and pulling in your funds together, because it's such an important, and all of us are going to be at that age, right? Like, we're going to get there, hopefully, God willing. So any other questions? Okay, go ahead, please.
So this is a lot about redesign and being able to redesign the environment, which is super important. But what are some solutions or things you can do when that's not an option, and you're dealing with people that are getting hit on the streets, they're older adults? What can we do to start?
I'm looking at you, Kim. Do you
Oh,
want
sure. I mean, first of all, you have to start with drivers, right? I mean, the onus is not on your pedestrians here, right? So, and you've got to figure out how to help create environments that are slower. And if you can't do it through engineering, you're going to have to do it through communications and automated enforcement, right? And obviously it's a time where we have to think about equitable enforcement that looks at very particular things that are actually hurting people. You also really want to take the data and talk to older adults about what they're up against. What my older adults are up against might not be what's actually causing the crashes for you. So take the time to try to figure out what's really happening, to help them plan their routes better if it's turning conflicts, or really looking in their neighborhoods and helping them figure out how to get from place to place, and not in an infantilizing way, in a let's try to figure out, while we wait for the funding to come in, what you can do to protect yourself in the traffic environment. That would be what I would suggest.
Yeah, and I could see that too, because I work with older adults, and I have older adults that tell me, there's a very busy intersection right out their front door, downtown Portland, Oregon, right? So instead of going down a block and crossing where there's less traffic, they walk right out the door, walk across this, and people get hit.
Right. And this is also, so the two things you can do is say, you're going to have to walk down the block and cross here because of turning conflicts. You're also going to have a letter writing campaign right away to talk about this intersection, because it's a problem, and everybody else who lives in this or goes to this older adult center, what else, knows that this is a problem. So you try to do the two layers at once, but it is hard to ask our older adults to go a block out of their way. But I think when people understand what they're up against, learning a route will make sense to them.
Thank you.
You're welcome. I hope it helps.
We have another question. Did you want to add anything, Sirisha or Justin, to that?
I'm sorry, I don't mean to.
No, perfect.
Hi. Just wondering if everybody's slides are on the download. I only saw one download and not Is it
Sorry,
just
that's my fault. I'm really bad at
I think Kim will upload it later,
I
so
will.
you shall.
I was trying to figure it out. These guys will help me to do it.
Okay,
Yeah.
good. Because Kim, I want to say, I'm from Richmond, Virginia, and I want to say that we've adopted in Richmond the Vision Zero, and
Isn't it great?
I'm on that planning committee, and they're asking, advice on, what should we do and stuff like that, and road diets and stuff. I said, you know what? Whatever you do, look at New York City. Model it after New York City. It is perfect.
Thank you.
I love New York City. My dad used to live in New York City. He passed about 2 years ago, but I love the street diets. It's fabulous. The crossings, the little islands. Back in the day when I traveled in New York City, I would try to, go a certain speed and catch every single light, and now you cannot do that, which I feel is much safer. It's a little bit annoying, but it's much safer.
Well, you have to drive under 25 miles an hour, and
Yep.
then I promise you'll find a new green wave. So that about 22.
So thank you, Kim.
Sure. Thank you. I appreciate that. That's Eric. She said we're doing good.
We have a question over here on that side of the room.
Hi, my name is Melody, and I'm from the Colorado DOT. And my question is for Sirisha. And I was wondering if your study resulted in any additional funding for local Oregon
question.
communities to implement the countermeasures that you recommended.
That's a good question, and unfortunately, I don't know the answer to that. Our role as researchers is, do the study and give the implementation solutions to ODOT, but that's a good question. I am not sure.
Do we have any other questions or comments? Oh, we have two. Perfect. Oh, sorry, and then we'll.
Real quick, anybody on the panel or maybe anybody in the audience that would be an expert on older populations as it relates to recreation. I also have a special education background, so making adjustments in curriculum and things like that. Not just looking for infrastructure to make things safer as we go out into the world, but how to change actual the instruction of what we're doing in recreation. This goes beyond what we're talking about right now, but just wondering if there's anybody in the audience in the room with that sort of expertise.
So I'll take that a little bit. I'm not sure that I can answer exactly your question regarding recreation, but one of the prime reasons, there are a lot of reasons why pedestrians get hit and killed at night, but one of the major reasons for that is basically limitations to the way the human visual system works, which I don't need to go into right now. I can if anybody wants to. But basically, everybody thinks that they can see and be seen more than they actually can. So drivers overdrive their headlights. The roads often support that. They don't realize that they're not able to see a low contrast pedestrian. Likewise, pedestrians see big, bright cars coming at them, and sometimes, especially if they have something like a vest, they overestimate how much they're able to be seen as a human. So there has been some research suggesting that training to help pedestrians understand the real distances that they can be seen at, which is a lot closer than they think, and conversely help drivers understand their own limitations, can help drivers and pedestrians make better decisions about when it's safe to cross. So that got sort of abstract, but if you're a pedestrian and you see the car, who's 3 seconds away from you coming in, but it's got big bright headlights, they can see me. So, just teaching my own kids this is just stay off the roadway when you can. If there's a car, stay out of the road. And there are different contexts to this. We're in a rural area, and so that's sort of different from the New York City crossing problem. But it is tough to avoid. You absolutely don't want to put the onus on people not to be hit. That is victim blaming. That's not okay. But at the same time, I don't want to be hit, and I don't want my kids to be hit.
Yeah, do what you can to be
Yeah,
seen.
yeah.
That's what we like to say.
Yeah, and I would just add on to that people sometimes there's, that's, sometimes doing something they think has more of an effect, like NHTSA for a while, they might still has like a wear light colored clothing campaign, which doesn't help.
Nitsa's in the room.
I know, sorry.
No, we're trying to move away from that.
She's never
because-
inviting me back.
No. We're trying to move away from that and like shift it from
Yeah.
victim blaming because, it's like what Kim was saying, do what you can, but sometimes you just can't because.
Which is why I preach just stay out of the road.
Yeah, and literally, our older Americans they may not be able to afford to switch out their wardrobes, you know what I mean? We've got to figure out what you can do. There may be some
Right.
low-cost things
Well,
you can do.
And I don't mean to get more on the tangent, but the only thing that actually makes a difference is wearing retroreflective strips on all your joints, which is ridiculous. Nobody's going to do that, but biological motion, that's when they see it's a
Oh, I
pedestrian.
saw that. You're the one who gives that
Yeah,
presentation.
yeah, see,
That's so smart.
That slide in. Yeah, this is what I cut my teeth doing this research 25 years ago, like on test tracks, actually seeing the distance at which people can be recognized, and people simply wearing a little flasher, retroreflective vest, they can be seen, but they're not recognized as pedestrians.
person.
They're not a person. Yeah.
It's fascinating.
Yeah, so that's really important. So that's again, I really hate to cross over into what might be victim blaming, but you have to protect yourself.
I understand.
And I'd even go beyond try to be seen to just don't be in the road, which is impossible, but when possible.
I understand.
And then we had one question here.
Thank you. A quick question on Portland. I remember you mentioned that the mid-block crossing was really, really low. I was wondering, do you have smaller block size, or because on some of the super blocks, pedestrians, especially older pedestrians, I don't think they're going to want to walk to the nearest intersections and cross. They're going to just cross mid-block. So have you done any analysis why that measure particular thing was very low?
Yeah, so yes, in Portland, at least in downtown and other areas, our intersections are pretty closely spaced. So that could be a factor. Most of the crashes that we were seeing were in the urban context. And the city of Portland developed their pedestrian plan a few years ago, and so in that plan was a mandate to provide pedestrian crossings at every transit stop, and they looked also at different land use contexts. So I think in the urban context, it was every 500 feet or so they're required to provide crossings. So they give many more crossing opportunities, and so that could be a reason why.
We have a question back there, please.
Hi, good afternoon.
Good afternoon.
My name is Valerie. I'm from Traffic Safety Commission of Puerto Rico. And I want to ask about, for Vision Zero, do you have like a model action plan that you guys give to other countries or other states? Because Puerto Rico does have high incidence on pedestrians, and we would like to see how we could apply this on our country.
Sure. So there's a lot of Vision Zero cities. I'd say we're up to about 40, 45 of them. It is a requirement on a lot of levels to be a Vision Zero city. Our action plan was surprisingly effective for a plan we put together in a month, and that was in 2014. So you can go to just look up Vision Zero NYC. You'll get we have a website. You look in data, your plans and reports or whatever, and you'll see every plan there. So the initial action plan, I actually really thought it was going to be police, professional drivers, and the Department of Transportation, but we learned a lot. And so we published 7 different plans for each year, the things that we planned to do and the things we got done and the things that were most effective. Now you can see on the website there are some things like that. But also my colleagues on the Vision Zero Task Force are always happy to make some time to talk about this. And we actually have a policy person at the Department of Transportation who is from Puerto Rico, who works on, she's the best, Irene Figueroa Ortiz, and she works on our e-micromobility issues, but also has a lot of fluency in Vision Zero and could literally translate, but also, she would be able to understand the typography in Puerto Rico to help you.
Thank you.
You're welcome.
And also just to plug, you have multilingual resources, right? Like for
Oh,
education. So if you all are interested, I would direct you to their site, and they have really good materials as well. So you don't need to reinvent the wheel, maybe just tweak something. So do we have any other questions? We have one here.
Question for Kim. So a lot of your solutions are data-driven, look very impressive statistics. Are there any countermeasures, engineering-wise or enforcement-wise, that you've tried and pulled back from due to, how they've been?
Yeah, I mean, it's really complicated, right? There are some things that people want us to do, like everybody's really into daylighting right now. And the truth is, like, when we actually look at it, we don't get the same results from it that we hope for. We really have to have something in the curb space. But then, we announced 1,000 daylighting intersections because we had a child killed in a situation. So sometimes we can get ourselves into like a little bind, right, where we make promises that are difficult. Right now, everything is shifting for us onto two wheels, right? So it's not really whack-a-mole, but it's like rethink. We had 40% of our fatalities were people on two wheels last year, including electric scooters, stand-up scooters, illegal mopeds, motorcycles, and bicycles, and electric bicycles. So, we did not see that coming. So we always have to shift the wind. But when it comes to pedestrians, that combination of speed reduction and street redesign has been amazing. And we have a huge automated enforcement plan. But now we realize we need to ask for more red light cameras, not just speed cameras, because we have so many T-bone crashes. And in New York City, if you have a T-bone crash, where do your vehicles go? They go up onto the sidewalk. And that's how we lose not just drivers and car passengers, but also the pedestrians who can't get out of the way of a crash like that. So so we are trying to move things. And then the other thing is that we're just looking for more technology. There's only so much that the ground is going to change. That's where we look to our DCAS colleagues who look at, speed, integrated speed, telematics, looking at even, more progressive interlock systems, things like that, to try to bring everything down. So it's a very long process, and we just have a lot of work to do.
Do we have any other questions or comments? So, seeing none, I just want to thank our wonderful panel. If we can give them another round of applause. And just one last thing, if you can fill out the evaluation, it really helps us out. And I just want to thank you for joining us. So thank you, everyone.
And thank you, Allison.
Thank you, Allison. We really appreciate it.